Hello everyone, I hope everything is going well with you. This is our fourth lecture. We will take today medical practitioners and we will take the different titles of doctors according to their specialities. Practitioner. In Britain, doctors, also known as medical practitioners, must be qualified. How to be qualified? How to be qualified? By having a university degree in medicine. They must also be registered, which means included in the General Medical Council's list, or register in order to practice. So, what does the doctor do in order to start practice? They have to be qualified, which means have a university degree, and be a registered doctor, which means included in General Medical Council. So, General Medical Council is in UK, in Britain. The equivalent of this in Egypt is the Egyptian Medical Syndicate, which means in Arabic نقابة الأطباء. A doctor who treats patients, as opposed to one who only does research, is called clinician. What is the meaning of this sentence? Doctor is a general term. It refers to anyone who does research. However, a clinician is a doctor who treats patients. So, clinician is a specific word. Doctor is a general term. And as we said, a registered doctor means included in the Egyptian Medical Syndicate. A doctor who provides primary care for patients is known as a general practitioner, GP. General practitioner in Arabic means ممارس عام, or a family doctor. GPs usually work in a group practice. Larger group practice work in a building called health care. So a group practice is a group of associated physicians or dentists, so doctors from different fields, working as partners in the same place. This place is called group practice. Large group practice is called health care. That is a building with different doctors in different fields. This is health care. In British English, the verb is spelled practice with S, and the noun is spelled practice with C. All right? Specialities. Specialist doctors, for example, pediatricians. If you remember, in the first lecture, we have taken pedia or pedio means child. So pediatrician means what? Doctor who treats the diseases of children, that comes to children. Generally work in hospitals. So specialist doctors, they work in hospitals. However, those who work outside the NHS, providing private health care, may have consulting rooms outside a hospital. All right? What is the meaning of this part? Those who work outside the NHS. What is the NHS? It's the National Health Service in Britain. National Health Service, NHS, is a system of health insurance in UK. It refers to the government-funded medical and healthcare services that everyone living in the UK can use without being asked to pay the full cost of service. So, for the National Health Service, they provide medical service, for very low health fees, for a very low fees. All right. In contrast to or versus the private health care. Doctors who work in UK outside the National Health Service, they have consulting rooms. What is the meaning of consulting room? Consulting room means a clinic, all right? عيادة. A room where a doctor examines a patient. In Egypt, we don't have this organization, the National Health Service. In Egypt is the medical insurance. All right. This part is related to what we have taken in the first lecture, the prefix, root, and suffix. We have cardiologist. What is the meaning of cardiologist? We have taken that cardio means heart, and ologist means specialist. So cardiologist means what? Doctor who is specialized in the diseases of the heart and the circulation. And we have taken that ology means the study of. So cardiology means the study of the heart and the circulation system. The second one is geriatrician. We have taken that gerio geri or gerio means old people. So geriatrician is what? Ishan means again specialist. So geriatrician is a doctor who is specialized in the diseases of elderly patients, right? And the noun is geriatrics. X refers to the study of. Right? So we have ology means the study of, and we have XICS means the study of. An anesthetist. We have taken also anesthetist comes from anesthesia, right? مخدر. So an anesthetist is specialized in anesthetics, right? So here in this part, name of the names of specialities usually end in ology because it means study of. Names of specialists used usually in ologist, like as we said, cardiology and cardiologist. If the name of a specialty ends in X, like in geriatrics, the name of the specialist ends in tion, like geriatrician. And we have pediatrics and pediatrician. There are some exceptions, like anesthetics and anesthetist. All right? Choosing a specialty. Jill Matthews had just graduated from medical school and is talking about her future. I haven't decided what to specialize in. These are called collocation. You see this word? Collocation. What's the meaning of collocation? It means a verb and a preposition. فعل وحرف جر. Alright? They come always together, like specialize in. Alright? I need more experience before I decide, but I'm quite attracted to the idea of pediatrics because I like working with children. I'd certainly prefer to work with children than, say, elderly patients. So I don't fancy geriatrics. So she prefers pediatrics on geriatrics. I was never very interested in detailed anatomy. So the surgical specialties like neurosurgery don't really appeal. You have to be good with your hands, which I don't think is a problem for me. I've assisted at operations several times, and I've even done some minor ops by myself. But surgeons have to be able to do the same thing again and again without getting bored, like tying off cut arteries and so on. Tying off cut arteries and so on. I don't think that would be a problem for me, but they need to make decisions fast, and I'm not too good at that. I like to have time to think, which means surgeries properly not right for me. So in this part, the collocations are specialized in, working with, interested in, surgical specialties, neurosurgery, good with, assisted at, good at. These are called collocation. I've said that the collocation is a verb and a preposition, and it can be two words that always come together. All right? Write sentences to describe the work of the specialist in each branch of medicine. Look at B, this part, to help you. So we will describe this part. We have, for example, dermatology. A dermatologist specializes in diseases of the skin. I'll show you the definition of these words and the definition of other words of medical practitioners, right? We will take different types of doctors according to their specialty. We have a dermatologist focuses on diseases and conditions of the skin, nails, and hair. They treat conditions such as eczema, skin, cancer, and acne. We have said that the root derma, what is the meaning of the root derma? It means skin. So dermatologist is a doctor who focuses on the diseases and the conditions of the skin. Rheumatologist. A rheumatologist specializes in complex diagnosis and treatments of arthritis and rheumatic illnesses, rheumatism. So, arthritis, what is the meaning of arthritis? If you remember from the first lecture, arthro means joint. Arthro means joint. And iris means inflammation of. So arthritis means inflammation of the joints. Traumatologist. A traumatologist specializes in accident and emergency medicine. Trauma here, what is the meaning of the word trauma? Trauma means shock. Trauma means shock. So a traumatologist specializes in accidents and emergency medicine. Pediatrician specializes in diseases affecting children. An obstetrician or gynecologist specialize in providing preventive care and disease management for female health conditions. We said that the root gyno means what? Woman or female. So gynecologist means a doctor who is specialized in the female health conditions. This includes what does the gynecologist or the obstetrician do? They focus on female reproductive health, cancer preventions and diagnosis in the female reproductive organs, breast cancer, pregnancy, labor and delivery, infertility, and menopause. So this is the answer of this part. Let's take some more titles of medical practitioners. We have, for example, allergist. Allergist or immunologist comes from what? Allergy and immune, like the immune system. So the allergist or immunologist focuses on preventing and treating allergic diseases and conditions. These usually include various types of allergies and asthma. Allergists also require training in internal medicine or pediatrics. ophthalmologist. Ophthalmologists specialize in eye and vision care. How to pronounce this word? We divide it into two parts, ophthal and mologist. Ophthalmologist. They treat diseases and conditions of the eye and can perform eye surgery. So ophthalmology means علم البصريات in Arabic. They treat people with complex eye conditions and may also see people for routine eye care, including prescribing glasses and performing checkups. Cardiology, we have taken this word before. Cardiologists focus on the cardiovascular system, which includes the heart and the blood vessels. They treat many cardiovascular conditions such as high blood pressure, high cholesterol, heart attack and stroke, heart rhythm problems, and congestive heart failure. Endocrinologist. As we said, endo means within. We have the prefix endo means within. And we have crin, the root crin means secrete, which means in Arabic euphrates. So endocrinologists treat disorders and conditions that affects the endocrine system. What is the endocrine system? The glands that produce and secrete hormones that control and regulate nearly all of the body's function. Endocrinologists treat hormone-related conditions such as diabetes, thyroid conditions, hormone imbalances, infertility, growth problems in children, and adrenal gland conditions. We have also gastroenterologists. As we said, the root gastro means what? Stomach. And the root entero means what? Intestine. And the suffix ologist means specialist. So this word gastroenterologist is a doctor who specializes in treating the functions and diseases of the digestive system, the stomach and the intestines. This includes the esophagus, pancreas, stomach, liver, small intestine, colon, and gallbladder. They also perform procedures such as endoscopy, sigmoidoscopy, and colonoscopy. We have also the nephrologist. We have taken the root nephro, that means what? Nephro means kidney. So nephrologist is a doctor who is specialized in the diseases of the kidney. Focus on kidney care and conditions that affect the kidneys. Conditions they can treat kidney disease, renal failure. If you remember, we said that also ren means also kidney. Renal failure, diabetes, hypertension, and kidney stones. Pulmonologist treat the cardiopulmonary system related to the lungs, which consists of the organs that work together to help a person breathe, such as lungs and heart, because we said that pulmono refers to the lung. Pulmonologists may work in hospital to provide ventilation or life support. They also see people in the office to treat breathing disorders, lungs condition, and allergies. The next one is otolaryngologist. How to read this long word? We divide it into syllables, parts. We say otolaryngologist. Otolaryngologists are sometimes known as ear, nose, and throat doctors, which is abbreviated as the initial of this word, E-N-T, doctors, E-N-T. An ENT doctor or otolaryngologist or otolaryngologists may treat problems with the sinuses, throat, tonsils, ear, mouth, head, and neck. Some ENT doctors undergo additional training to focus on one specific area, such as pediatrics or rhinology, which refers to the nose and sinuses. All right? We have psychiatrists. Psychiatrists treat mental health condition. They may use counseling, medication, or hospitalization as part of their treatment. Some psychiatrists have a subspecialty in a specific area, such as adolescent mental health or addiction medicine. Oncologist. If you remember, we said that the root onco refers to tumor, which means in Arabic, waram. Oncologist is a subspecialty of internal medicine, which has three main areas: medical, surgical, or radiation oncology. Oncologists take care of patients who have cancer by treating the cancer itself as well as the symptoms caused by the disease. All right? So, mostly they take care of the cancer patients and, of course, any other tumors. Neurologists are doctors who take care of patients with medical conditions that affect the brain, spine, or nerves. People may see a neurologist for epilepsy. You remember this word we have taken last lecture, epilepsy. Epilepsy, that means in Arabic, Sara. Alzheimer's disease, Parkinson's disease, we have taken it also in the previous lecture. Neuropathy, stroke, and migraine, which is a type of headache. All right. Let's move to the next exercise. Complete the table with words from A, B, and C, opposite and related forms. Put a stress mark in front of the stressed syllable. You remember we said that one of the famous examples about stress is the difference between the word comment and comment. Comment is the verb and comment is the noun. So we have specialize. What is the noun that we will say the noun that refers to the person who does the verb, and the noun which is the activity or the thing itself. Let's take an example. We have specialize. The noun is specialist, the person, متخصص, and speciality, تخصص. So we will say the person and the activity or the thing. Like we have practice, practitioner, and practice with C. So here we have practice with S means يمارس. Practice with C means ممارسة, the noun itself. Consult, we have consultant and consultation. We have assist, assistant, and assistance. Graduate, we have graduate and graduation. Qualify, there is no noun that refers to a person here, and we have qualification. Of course, when you write it without the stress mark, but I wanted to show to you where is the stress mark here. You see? Let's move to the next exercise. Find prepositions in C. In this part, that can be used to make word combination with the word in the box. We have good, interested, specialize, and work. With good, we can say good at or good with, right? With interested, we say interested in. Specialize, we say specialize in. Work, we can say work with. And after with comes a person, like with old people. With a pathologist, we said that patho means disease. So a pathologist, what? Diagnosing disease through examining cells and tissue. A pathologist specializes in diagnosing disease through examining cells and tissue. A pediatrician enjoys working with children. An oncologist is blank the diagnosis and treatment of cancer. So an oncologist is interested in. A psychiatrist must be blank counseling. So must be good at. A neurosurgeon must be what? Her hands must be good with her hand. Make word combinations using a word from each box. Two words can be used twice. We have counseling, we have consulting, we have general, group, health, internal, and surgical. We have here center, practice, specialties, medicine, practitioner, and rooms. From the words that we have taken today, we can say consulting rooms, which means clinics, general practitioners, general practice, health center, internal medicine, surgical specialties. So this is for the first part. For the second part, medical practitioner 2. Hospital staff. The people who work in any type of workplace, including hospital, are called the staff. The medical staff in British hospital belong to one of the four main groups. This system is mainly in Britain. So we will take these titles quickly and see their equivalent here in Egypt. A pre-registration house officer, abbreviated as PRHO or house officer, is a newly graduated doctor in the first year of postgraduate training. After a year, he or she becomes a registered medical practitioner. In the current system of training, the foundation program, the name of these junior doctors is Foundation Year 1 Doctor and Foundation Year 2 Doctor. Foundation Year 2 Doctor, they are called also Senior House Officer. Senior House Officer. And house officer in Arabic is طبيب مقيم. We have a specialist registrar, is a doctor who has completed the foundation program and is training in one of the medical specialties. There are also some non-training registrars, doctors who have completed their training but do not wish to specialize yet. A consultant, استشاري in Arabic, is a fully qualified specialist. Specialist in Arabic means أخصائي. There may also be some associate specialists, senior doctors who don't wish to become consultants. In addition, there is at least one medical or clinical director who is responsible for the medical staff. So the person who is responsible for the medical staff is called medical or clinical director. Doctors in Egypt complete their basic medical education coursework, then get clinical training, making it a total of 7 years. The students start an internship year, which is in Arabic سنة الامتياز, doing clinical rotation, and finally graduate at the end of that year with a bachelor degree in medicine, to be officially called general practitioner. So after the internship here, the title is general practitioner. The internship here is supposed to help the student pick their specialty based on the clinical experiences they have. We have also specialist, and after the specialist we have consultant, and then we have professor. Medical teams. Consultant physicians and surgeons are responsible for a specific number of patients in the hospital. Each consultant has a team of junior doctors to help care for those patients. So we have physicians and we have surgeons. In many hospitals, there are multidisciplinary teams, which consist not only of doctors, but also of physiotherapists and other allied health professionals. When patient enter or admitted to hospital, we say patient is admitted to. Patients are admitted to the hospital. They are usually seen first by one of the junior doctors. So first, a junior doctor examines the patient. On the ward where they will receive treatment and care, the junior doctor clerks them. What is the meaning of clerk them? Clerk the patient. It means takes their medical history. It means to take their medical history. Again, when a doctor clerks a patient, it means the doctor takes the medical history of the patient and examines them. Sometime later, the registrar also sees the patient and may order investigations or tests. For example, X-ray or an ECG. Make a provisional diagnosis. ECG refers to electrocardiogram tests. The consultant usually sees new admissions. What is the meaning of new admissions? It means people or patients who have recently been admitted to the ward for the first time on one of the regular ward rounds. When the management of the patients is discussed with the registrar, consultant also decide when a patient is ready to be discharged. What is the meaning of discharged? It means to be sent home. On the word round, the consultant is accompanied by the team and a nurse, and they visit all patients in the consultant's care. Shifts. So here, before moving to the next part, we have the word, the verb admitted to means to get in the hospital. We have discharge means get out of the hospital, to be sent home. We have the word ward. We have clerk. When a doctor clerks a patient, it means to take their medical history and examines them. We have new admissions. New admissions means the patients who get in or are admitted to the hospital. All right. And we have investigations and tests. Shifts. Junior doctors now normally work in shifts, which means they normally work for 8 hours every day. For example, from 7 a.m. to 3 p.m. and are then free until 7 a.m. the next day. After a week, they change to a different shift. For example, from 3 p.m. to 11 p.m. or 11 p.m. to 7 a.m. The alternative system is to work from 9 a.m. to 5 p.m. every day and to take turns, to be on call, available to return to the hospital if necessary, from 5 to 9 a.m. the next day. Days on call are set out in a rota. What is the meaning of rota? Rota means a list showing when each of a number of people has to do a particular job. So a rota is a list with the names of the doctors and their job, their tasks. Doctors on call carry a radio pager or bleeper, a device which makes a noise when someone is trying to contact them. All right? So we have the word shift, we have on call, rota, and radio pager or bleeper. Let's see the exercises on these words and new vocabulary we have taken today. Make word combination using a word from each box. We have associate, we have house, on, provincial, radio, and ward. We have call, diagnosis, officer, pager, round, and specialist. We say associate specialist and house officer. On call, provisional diagnosis. A provisional diagnosis means that a doctor is not 100% sure of a diagnosis, but more information is needed. So when the doctor see a patient, they make a guess about the diagnosis of what this patient suffer from. This is called provisional diagnosis. With a provisional diagnosis, the doctor makes an educated guess about the most likely diagnosis. We have radio pager, and we have word round. Match the description from 1 to 5 with the job titles. Look at A and B opposite to help you. We have specialist registrar, medical doctor, director, consultant, SHO, and PRHO or house officer. Dr. Graham has been a pediatrician for 8 years and is responsible for treating the children admitted to Ward 60. This is a consultant. Dr. Stewart has just started the second year of her foundation program. This is SHO, which is an abbreviation of Senior House Officer, because she is in the second year. Dr. Snai has started his training as a surgeon. This is started the training, so this is a specialist registrar. Dr. Phillips had just graduated and is working in a large hospital in Birmingham. This is Birmingham. This is a PRHO or house officer. Dr. Miller is in charge of the medical staff in Birmingham Hospital. This is in charge of the medical staff, so this is the medical director. This part is not important. It's mainly about the system in Britain, so we will not answer it. It's about information that we will say it's true or false according to the lesson, but it's not relevant here, mainly in Egypt, so we will skip it. Number 6.4. Complete the text of a PRHO or house officer describing her job. Look at A, B, and C opposite to help you. We will look at the words in A, B, and C in order to be able to answer this part. When I get to the word, the first thing I do is talk to the house officer who was on duty during the last. The answer here will be the last shift. To find out if there have been any new, the answer here will be any new what? Any new patients who get in or are admitted to the hospital. Any new patients who are admitted to the hospital. So we can say here what is the equivalent of this sentence is new admissions, and find out if there have been any new admissions, patients. All right. Then I generally see the charge nurse. He tells me if there is anything that needs to be done urgently, such as intravenous lines. What is the meaning of intravenous? It means, we said that intra means within. So intravenous means existing or taking place within or administered into vein or veins. All right, because intra means within and veno means vein. So she check if any of the patients needs intravenous lines to put up or take down. Later in the morning, I what any new patients. So here I clerk, which basically involves taking a history. Taking a history of the patients means clerk. On Tuesday and Friday morning, the consultant does her word what? Word round. And I have to make sure I'm completely up to date on her patients. After that, there are usually lots of things to do, like writing up requests forms from blood, blood what? Blood test, and so on. In the afternoon, I have to prepare for any patients who are to be what the next day. They usually happy to be going home. What is the meaning of going home? Discharge. So to be discharged. And then, of course, there are the lectures and tutorials in the training, or we can say in the foundation program on Monday and Tuesday. This is for our lecture today. Goodbye.